acute revision examination module. So I would recommend all the students to take the premium plan. So they would have the access of all the features that are provided by Oracle. Okay. And also for instant discount, you can use my code, that is Aanchal 20. So as we have started the internal exam marathon series, so also this series has some core feature like rapid revision will be there of all the important topics, and volatile fact will be discussed. Multiple choice question will be covered, and also we assure top notch grade in the exam. And also this examination series is beneficial for all the students of it will be beneficial for university exams basically. So let's start with today's important topic. So in today's class, we're going to discuss the rest topics of the cardiovascular system, that is heart rate, arrhythmia, heart sounds, cardiac murmur, cardiac pain, and fetal circulation we're going to discuss. So first, we're going to learn about the heart sound. So as we know, heart sound are the sounds that are produced by mechanical activity during heart by mechanical activity of heart during each cardiac cycle, right? Now, the heart sounds are produced by three things. Like, first we have by flow of blood through cardiac chamber. Then, whenever there is contraction in the cardiac muscle, and whenever there is closure of walls of the heart. So in heart sound, we're going to discuss about 4 heart sounds, in which the 2 are very important, that is first and second. So basically, heart sound are those that are produced during each cardiac cycle, and first and second heart sound are known as classical heart sound, as they can be heard by using stethoscope. Right? So these heart sound are basically more prominent and resemble the spoken word, that is we have lub and dub, right? Also, we have another 2 heart sound, that is third heart sound and fourth heart sound, right? So third heart sound is a mild sound and it is not heard by using stethoscope in normal condition, okay? But it can be heard by using microphone. And fourth heart sound is an inaudible sound and it become audible only during pathological condition. If any pathological condition is present, so the fourth heart sound will be audible. Now, what are the importance of these heart sounds? So basically, study of heart sound has important diagnostic value in clinical practice, because any alteration in the heart sound basically indicates the cardiac disease involved that are present inside the heart, right? So one by one, we're going to discuss about the heart sound. So first, we're going to discuss about the first heart sound. Okay, so first heart sound is produced during isometric period. Okay, so the first heart sound produced during isometric contraction period. And also during earlier part of ejection period. Now, what are the causes of first heart sound? So basically, major cause of first heart sound is the sudden closure of AV valve. So this heart sound, the first heart sound produced during closure of AV valve, right? And some other factors are also involved. Other factors like if any other factors includes like valvular factor, muscular factor, like any myocardial tension are there, or rush of blood from the ventricles into aorta are there, or arterial factors are also there, like whenever there is vibration produced by the arterial systole, that also play a very important role in the production of first heart sound. Okay, so basically this heart sound that is known as lub, this basically represent the closure of AV valve, and it occurs during the beginning of ventricular systole, and this is the loudest at the apex and lower left sternal border, right? So this is all about the first heart sound. Now, next we have the second heart sound, and second heart sound is known as da. Okay. Now, this second heart sound is basically produced at the end of proto-diastolic period, right? And the second heart sound is produced due to sudden and synchronous closure of AV valve. So whenever there is closure of AV valve closure represent first heart sound, dub represents semilunar valve closure. Okay. Now this second heart sound is short, sharp, and high pitch, and it resembles the spoken word dub. Okay. And this represent end of ventricular systole, and also this is the loudest at the base of the heart. So this is all about the first heart sound and second heart sound. Now we have the third heart sound. So as we have discussed, this heart sound is not audible by using stethoscope. It can be audible by using microphone only. Okay. So third heart sound is basically a very low pitched, and this is produced during rapid filling period of the cardiac cycle. Okay. Usually the third heart sound is inaudible, and if stethoscope is used, it can be only heard by using microphone. So that already we have discussed. Now, what are the causes of third heart sound? So as we have discussed, the third heart sound is produced by rushing of blood into ventricle and vibration set up in the ventricular wall during rapid filling phase. Okay. Now, if we talk about the characteristic feature of third heart sound, so basically this third heart sound is short and low pitch sound, and duration of this sound is around 0.72, 0.072, 0.01 seconds. Okay, so this is all about third heart sound. Now next we have the last one, and that is fourth heart sound. Okay, now this heart sound, the fourth heart sound produced by contraction of arterial musculature and the vibrations that are set up in the arterial musculature. So basically we can write that the fourth heart sound produced during contraction of arterial musculature. Right? Now, what are the characteristics feature of fourth heart sound? So, fourth heart sound is short and low pitch sound, and duration of this sound is around 0.02 second to 0.04 second. Okay. And talking about the frequency, so its frequency around 1 to 4 cycles per second. Right? So, this is all about the major heart sound that we have discussed. So we have covered first heart sound, second, third, and fourth. Now we're going to have a recap of whatever we have discussed. Okay, so here we have first heart sound, then second heart sound, then we have third heart sound, and fourth heart sound. So one by one, we're going to discuss about all these heart sound once again. So as we have discussed, what is the cause of first heart sound? So first heart sound produced due to closure of AV valve, right? And what is the cause of second heart sound? So this is produced due to closure of semilunar valve. And the third heart sound produced due to rushing of blood into ventricles. And the fourth heart sound produced due to contraction of arterial musculature. Right? Now, next we have these heart sound occurs during which phase? So, the first heart sound occur during isometric contraction period. And part of ejection period. Then second heart sound occur during protodiastole. Then third heart sound occurs during rapid filling phase. And finally, the fourth heart sound occurs during arterial systole. Okay. Now, characteristics features. Excuse me. So, first heart sound is basically long, soft, and always of low pitch. Whereas the second heart sound is short, sharp, and high pitch. And third heart sound is of low pitch. And fourth heart sound is a inaudible sound, and it become audible only if any pathological condition is there. Okay, so this is all about the recap of the heart sound. Next, we have the another important topic, that is cardiac murmurs. Okay, so what is cardiac murmur? This is the abnormal or unusual heart sound. Okay, so this is abnormal or unusual heart sound. Okay. Okay. So basically, this cardiac murmur is heard by stethoscope along with normal heart sound, and this is heard by placing chest piece or stethoscope over the auscultatory area, and this murmur occurs due to presence of a particular valve is heard well over the auscultatory area of that valve. Sometimes also the murmur is felt by palpations as thrills. Okay. Now we're going to learn about the causes. What are the several causes due to which this condition arises? So causes like, first we have stenosis, and second we have incompetence. Okay. So what is stenosis? Stenosis means narrowing of heart valve, right? And blood flows rapidly with turbulence through the narrow orifice of the valve, resisting in the murmur. Okay, next we have incompetence. So incompetence refers to weakening of heart valve. And when the valve become weak, it cannot close properly. Therefore, it causes backflow of blood resulting in turbulence. Okay. So this is all about the causes. Next, we have the classification. So when we talk about the classification, so in this we have systolic, then next we have diastolic, and third we have so one by one, we're going to discuss about them. So first we have systolic murmur. So basically this is the murmur which is produced during systole. That's why it is named as systolic murmur. And it occurs due to following condition, like whenever there is incompetence of AV valve, or if there is any stenosis of semilunar wall. Okay, and also it can occurs in the condition like anemia due to septal defect. Okay, so these are the reasons. Now next we have diastolic murmur. So basically this occurs due to stenosis of AV wall, and also it can occurs due to incompetence of semilunar wall. Finally, the last we have continuous murmur. So this occurs when due to patent ductus arteriosus. So one by one, we're going to discuss all of the conditions. So first we have incompetence of AV wall in systolic murmur. So basically this arises whenever arterioventricular walls become very weak and these walls cannot close completely. Okay, so if it will not close completely, so what will happen? There will be regurgitation of blood from ventricle to arteria during ventricular phase that will lead to the producing of systolic murmur. Okay. Next, we have stenosis of semilunar wall. So basically, during stenosis of aortic wall, the left ventricular pressure will rise, and that will rise up to 300 mmHg during systole, and it will cause a greater turbulence of in the blood flow, and the vibration of this sound can be felt as thrills by palpation over lower neck region and also at the upper chest. Okay, then also anemia could be the region in which RBC count as well as hemoglobin count will be very low. Due to that also, systolic murmur can be felt. Then septal defect, due to septal defect. So what is septal defects? What happens? So during intraventricular septal defect, blood flow from left ventricle to right ventricle during systole, and it will produce the systolic murmur. Okay, but this septal defect is a very rare disease. Okay, so this is all about systolic murmur. Next, we have the diastolic. So in diastolic, we have mainly two causes. Firstly, we have stenosis of AV wall. So when the arterioventricular wall become narrow, the turbulence of blood flow occurs during diastole. That is when the blood enter the ventricle from arteria, and murmur due to stenosis of mitral wall is heard better at mitral area. Okay, so this stenosis of tricuspid wall is heard best at tricuspid area, and also it is a weak sound with a very low frequency, right? Now, next region of diastolic murmur could be incompetence of semilunar wall. So basically, this is produced during whenever there is a very low blood flow from aorta into ventricle through incompetence of semilunar wall during diastole. Okay, and it is like a blowing sound with very low frequency. And last we have the continuous one, and only one region is found usually in this condition, that is patent ductus arteriosus. What happened in this condition? In this condition, there will be a continuous murmur is heard, and the intensity of the sound is more during systole and very less during the diastolic phase. Okay. And also there will be a harsh blowing sound, and this is also best heard in the pulmonary area. Okay. So this is all about the cardiac murmur. Now next topic, another important topic we have is arrhythmia. So what is arrhythmia? As already we have discussed in last class also, arrhythmia refers to irregular heartbeats or disturbance in the rhythm of heart. Okay, so during arrhythmia, the heartbeat may be fast or it can be slow, or there may be an extra beat, or there can be a missed beat is present. Okay, and also it occurs due to both physiological as well as pathological condition. Okay, so we're going to learn about the classification of arrhythmia. So in arrhythmia, SA node may may or may not be the pacemaker, and if the SA node is not the pacemaker, then any other part of the heart such as arterial muscle, AV node and ventricular muscle will perform the role of the pacemaker. Okay, so we're going to learn the classification of arrhythmia. So in arrhythmia, basically arrhythmia is classified as normotropic and ectopic. Okay. In normotopic, we have sinus tachycardia. Then we have sinus bradycardia. And also we have sinus arrhythmia. That all about we're going to learn in detail. Then we have ectopic arrhythmia. So in ectopic, we have heart block. Also, we have extra systole. Then we have paroxysmal tachycardia. And several other regions are also there, like arterial fibrillation, ventricular fibrillation, then arterial flutter. Okay, other regions are also there. So one by one, we're going to discuss about all of them. So first, we're going to talk about normotopic. Okay, so normotopic means normotopic arrhythmia is the irregular heartbeat in which SA node is the pacemaker. Okay, so in normotropic, SA node is the pacemaker. So in normotropic, we have sinus tachycardia, sinus bradycardia, and sinus arrhythmia. So sinus arrhythmia is a normal rhythmical increase and decrease in heart rate, and in relation to respiration, it is called respiratory sinus arrhythmia, right? And normal sinus rhythm means the normal heartbeat with SA node as the pacemaker. And here the normal heart rate is around 72 per minute, and also under physiological condition and a normal healthy person, the heart rate varies according to the phase of respiratory cycle. So in this, heart rate increasing during inspiration and decreases during expiration. Okay. Now, next we have sinus tachycardia. So what happens is sinus tachycardia. Sinus tachycardia is the increase in the discharge of impulse from SA node. Okay, that results in increase in heart rate also, and discharge of impulse from SA node is very rapid, and the heart rate increases up to 100 per minute, and sometimes it can also go up to 150 per minute. Okay, so we have done with the we are done with sinus arrhythmia and tachycardia. Now next we have sinus bradycardia. Okay, so as the term refers, bradycardia. So what will happen? There will be reduction in the discharge of impulse from SA node, resulting in decrease in heart rate. And here the heart rate is less than 60 per minute. Okay. So various physiological conditions are there, like in sleep, and also in athletic heart, the sinus bradycardia is there, and pathological condition are also there. When sinus bradycardia occurs, when like disease of SA node, hypothermia, hypothyroidism, heart attack, congenital heart disease, various conditions are there. Okay. Now, next we have ectopic arrhythmia. So ectopic arrhythmia is basically the abnormal heartbeat in which one of the structure of heart other than SA node will be pacemaker. Okay. So in normotopic, the SA node is the pacemaker, and here in ectopic, other than SA node is pacemaker. Right? Now, we're going to learn about various conditions in which this can be occur. First, we're going to discuss about the heart block. Okay, so as we know, heart block is the blockage of impulse generated by SA node in the conductive system, right? And because of this blockage, the impulse cannot reach the cardiomusculature, as which result in ectopic arrhythmia. Okay, now based on the area affected, the heart block can be classified into various types like SA block, AV block. Okay, then next we have extrasystole. So what is extrasystole? Extrasystole is the premature contraction of the heart before its normal contraction. Okay, and it is caused by ectopic focus. Ectopic focus means discharge of an impulse from any part of the heart other than the SA node. Okay, and this ectopic focus produces an extra beat of the heart that is always followed by a compensatory pause. Okay, and what is compensatory pause? Compensatory pause is basically the period during which the heart stop in a relaxed state. Okay, now next we have the another condition, that is paroxysmal tachycardia. So paroxysmal tachycardia, basically it is a sudden attack of increased heart rate. Okay, and that can be due to ectopic foci arising from atria, AV node or ventricle. Okay, so whenever there is increase in heart rate due to ectopic foci arising from either atria or AV node, that is also known as supraventricular tachycardia, right? And it differs from ventricular tachycardia, which does not depend upon atria or AV node. Okay, then this attack lasts for a period of few seconds to few hours, and it also stops suddenly after the heart attack, heart function over. Okay, now next we have the last condition, that is arterial fibrillation. Okay, so arterial fibrillation is the type of arrhythmia which is characterized by rapid and irregular arterial contraction at the rate of about 300 to 400 beats per minute. And it is mostly due to circus movements of impulse within arterial musculature, and also in this condition the P wave is always absent in ECG. Okay, so if we see the ECG of the patient, so we will not found the P wave in that condition. Okay, so this is all about the arrhythmia. Now next another topic we have is heart rate. So heart rate already we have discussed in last class. So heart rate is basically normal heart rate when we talk about it is 72 per minute, and if we talk about the range, so the range lies between 60 to 100 per minute. Okay, so basically factors affecting heart rate are various factors like fitness and activity level, temperature, body position, medication the patient is taking, and due to age also it can affect it, emotions, if the person is a smoker or alcoholic, body size, and if the person is having any cardiovascular disease. So these are the factors which can affect the heart rate. And here we're going to learn about some physiological conditions in which tachycardia and bradycardia can occur. So tachycardia can occur during exercise, pregnancy, and due to emotional condition, if the person is having stress, fear, anxiety. Okay, then physiological condition when bradycardia occurs. So it can occur in the condition like fever, anemia, hypoxia, also in hypothyroidism, and cardiomyopathy. Right? So already I hope all the student knows what is tachycardia and bradycardia. So bradycardia means decrease in heart rate below 60 per minute, and tachycardia means increase in heart rate, right? So already we have discussed the physiological condition. Now some pathological conditions also we're going to discuss about bradycardia and tachycardia. So pathological condition, first we're going to discuss bradycardia. So bradycardia could occurs due to heart attack, then hypothermia, then uh, congenital heart disease, right? Whereas the tachycardia can occur if the temperature is raised or cardiac disease. Okay? So these are the reasons. Now, next we have the another condition that is known as cardiac pain, okay, or that is also known as angina pectoris, okay. So what is angina pectoris? Basically, this is the chest pain, right? And usually it is caused by a myocardial ischemia, okay. So what is the reason? The reason is myocardial ischemia. So it is a very common manifestation of coronary artery disease, and pain starts beneath the sternums and radiates to left arm and the left shoulder. Okay, so cardiac pain is referred as pain as it is felt over the body away from the heart. It is because heart and left arm develop from the same dermatomal segment in embryo, right? So I think about this already we have discussed in pain in CNS. Okay, in referred pain, this concept already we have discussed. Now, what is the cause of this cardiac pain? So, ischemia is mainly due to hypoxia. Okay. So, main cause is ischemia, that is mainly due to hypoxia. And during myocardial ischemia, there is an accumulation of anaerobic metabolic end products such as uric acid is there, then metabolites and other pain-producing substance like P substance, histamine, kinin that stimulates the sensory nerve ending and leading to this pain. Okay. Then also another condition is there that is known as chronic angina pectoris. So what is this condition? Basically, in this condition, the patient does not feel the pain normally, and the pain is felt only when the workload of heart increases. Okay, so pain felt only when workload load of heart increases. Okay. And also when the frequency of angina attack increases, the patient is also become very prone to develop acute myocardial infarction in these cases. Okay. So if we talk about the treatment of angina pectoris, so various drugs are there, right? Vasodilator drugs, then calcium channel blockers are there, then also some sympathetic blocking agents are there that is used for the treatment of this condition. Okay. Now, next we have the last topic of CNS, that is fetal circulation. And also this is the very important topic, and usually the question arises from this topic. Okay. So fetal circulation is different from that of adult because the presence of the placenta. Okay, placenta is there, right? So as we know, since fetal lungs are non-functional, right, and the only structure, that is placenta, is present, which is responsible for exchange of gases between fetal blood and mother's blood. So blood from right ventricle is diverted to placenta. Okay, so blood from right ventricle is diverted to placenta, right? So development of heart is incomplete at 4th week of intrauterine life, and it start beating at the rate of 65 per minute. Along with heart, the blood vessels also got developed, and heart rate gradually increases as it reaches a maximum up of about 140 beats per minute just before birth we are talking. Right now, fetus is connected with mother through placenta, and fetal blood passes through placenta through umbilical vessel. Right, so umbilical vessel are there through which the whole circulation is going to occur, and two sets of blood vessels that lies in very close proximity in placenta, through which the exchange of substances take place between mother's blood and fetal blood, and also there is no direct admixture of maternal and fetal blood. So now we're going to learn about the fetal circulation, how the fetal circulation occurs. Okay, so as we have talked about that in fetus the lungs are non-functional. Okay, so there is no necessity of large amount of blood to be pumped into lungs. Okay, so instead the heart pump large quantity of blood into placenta for exchange of substance. From placenta, the umbilical veins are there that collect the blood. Okay, so from placenta, umbilical vein are there that collect the blood, which has more oxygen and nutrients. Now this umbilical vein passes through the liver. Okay, and some amount of blood is supplied to liver from umbilical vein, and a large quantity of blood is diverted from umbilical vein to inferior vena cava. Okay, and that will occurs through ductus venosus. Please remember, okay, that will occurs through ductus venosus. And also liver receive blood from the portal vein. So portal vein is there through which the liver is going to receive the blood. Okay, now in liver the in liver oxygenated blood mixes slightly with deoxygenated blood and enters right atrium. Okay, so it will get enters to right atrium here. Through inferior vena cava. So from this, the blood is going to enters into right atrium through inferior vena cava, and also from right atrium, the major portion of blood is diverted to the left atrium, as we can see. Okay, that is diverted into left atrium through a ovale that is known as foramen ovale. Okay, now what is this foramen ovale? This foramen ovale is an opening in intra-arterial septum. Okay, so blood from right atrium will go into left atrium through this foramen ovale. And also blood from upper part of the body enters the right atrium, and from through superior vena cava. And from right atrium, blood enters into right ventricles, and from here the blood is pumped into pulmonary artery. Okay, so pulmonary artery is there, and from pulmonary artery the blood enters systemic aorta through a small vessel that is known as ductus arteriosus. Okay, and only a small quantity of blood is supplied to fetal lungs. Blood from left ventricle is pumped into aorta, and about 50% of blood from aorta reaches the placenta through the umbilical artery again. So again, this circulation will occur as usual. Okay, so this is all about the fetal circulation, and usually the question from fetal circulation arises. So please consider this as the most important topic for your university exams. Okay, so this is all about today's class, and I hope, I guess, we have covered all the important topics. Yes, we have done with heart rate, arrhythmia, heart sound, cardiac murmur, cardiac pain, and fetal circulation. So I hope you find this class helpful. Thanks for watching my class.